This presentation reviews basic pharmacological information that may be covered on the NCLEX examination. The NCLEX test plan evaluates the student's ability to provide care related to the administration of medications and parenteral therapies. Questions will fall into categories that evaluate the nurse's ability to recognize safe and effective medication administration. Under the categories on this slide, questions may be related to the nurse's ability to appropriately assess the client, administer the drug, observe for adverse effects, and evaluate the effectiveness of the drug. Client education for safe self-administration is also an important part of drug administration. Medication safety begins with having a basic understanding of the drug classes, the drugs that fit into the class, how drugs work in the body, why the drug is being given to a specific client, and what the client needs to be taught to safely self-administer the drug. Questions to ask yourself when learning about drugs include, why is the medication prescribed for this client, and what is the expected outcomes for this client? In other words, how will you know that the drug has been effective in treating the client's condition? What side effects, those effects that are expected, such as drowsiness after receiving an opioid or an antihistamine, and adverse effects, which would require the drug to be discontinued, such as anaphylaxis, bone marrow suppression, or the development of C. difficile, have occurred. Additionally, to safely administer medications, the nurse must understand how to administer the drug correctly and what to teach the client about the drug so that they can safely administer the drug at home. All of these questions can be the basis of an NCLEX scenario. Dosage calculations are common questions. Read them carefully for how to fill in your answer. The question may just ask for the number, so if you also add ml or mcg into the response box, the question will be marked incorrect. Questions may ask that the syringe be marked or to choose the correct syringe for the situation. Other questions may show a medication administration record, and questions may relate to that MAR and the client's medical situation. Questions may also ask for mixing of medications from 2 vials, for example, insulins, or may require you to review lab results, potential reactions or allergies from the MAR, and make a decision about administration. Age-appropriate medication administration is another aspect of safety that may be tested. Pediatric drugs are frequently weight-based, and being able to convert pounds to kilograms is important. For older adults, consideration for metabolism, liver function, and excretion, kidney function, are important, so knowing the normal levels of liver and kidney function lab tests will be important. Also, some drugs can be toxic at high levels, so remembering the normal serum lab levels of the drugs covered in the pharmacology course will be important to accurately answering some questions. For all females of childbearing age, it is also important to ask, is this medication safe to administer to 2 clients, the female and the fetus? Finally, an organized study plan is important to success on the NCLEX examination. First, look at your HESI scores and complete the suggested review packets. For pharmacology, plan to practice these questions along with your other questions. Understand that there may be some drugs on the NCLEX not covered in class, but the question will provide you with clues as to the indication for the drug. Please use the accompanying PowerPoint questions to help you prepare for the exam.